Introduction and welcoming me back. Today, I was asked to speak on a topic that's near and dear to my heart, which is integrative medicine, which I'm going to spend about the first half talking about. But then we're going to turn and focus more specifically about integrative medicine approaches to lupus. I was practicing in the Fremont, San Francisco Bay Area for many years until I returned home to Hawaii in about 2019. So it's nice to be back with the Lupus Foundation in Northern California. So with that, I'm going to go ahead and get started. So the objective for today's talk is to first go over and give you a general sense of the state of our nation's health as a whole. And I'm going to use this point of discussion to differentiate between traditional Western medicine or your regular doctor appointments, which are based on the ill pill model. And I'm going to contrast that with what an integrative holistic approach may be. What my patients in Fremont taught me is that whenever possible, especially for chronic diseases that we treat patients for, not using the ill pill model is preferable. A more holistic integrative approach is always preferable at first. However, we weren't taught that as doctors in training. And so this is something that I had to kind of learn and teach and discover on my own, but was greatly appreciated by my patients in Fremont, but also in my patients now in Hawaii. I do work with a telemedicine company now called Telemed2U. So I still see patients in California and also in Hawaii. And then I'm also going to explain to you what my sensible integrator approach to lupus is. And SENSE, as you'll learn, is an acronym about what I teach patients about customizing their own integrative holistic wellness plan or prescription, as I call it, for themselves. So I'd like to start off the discussion looking back almost 10 years now to the Institute of Medicine report from 2013. Harvey Feinberg was the president of the Institute of Medicine, and he said, "The United States, we spend much more money on healthcare than any other country, yet we die sooner and experience more chronic illnesses than people in different countries. While the length of life has improved in the United States and other countries, these other countries have gained life years even faster, and our relative standing in the world as far as quality outcomes in the United States has fallen over the past half century." I want you to just think for a moment, if we were to rank the United States in comparison with other nations, where would we stand in the world? Would we be in the top 3, top 5, top 10? And Dr. Feinberg also went on to say that the nation's current health trajectory is lower in success and higher in cost than it should be. And the cost of inaction or doing nothing is high. So I want you to think about where you think we stand as far as outcomes relative to other developed countries around the world. Just to give you an idea, 1.5 plus million patients in the United States live with lupus at a cost of almost $13,000 per patient per year, almost $20 billion in cost. So this is the last ratings. And as you can see, United Kingdom or Britain is ranked first in many of the overall and individual quality of care, access, efficiency categories here. United States is not even in the top 10. We are number 11. If you look on the bottom row, cost per patient, per citizen per year, we pay the most, almost $9,000. The most efficient, best quality of care in the United Kingdom, they pay less than half of that. So it's very unsettling to hear and know that we are paying so much more and getting so much less for our healthcare here. Now, I'm not saying for you to abandon all your physicians who practice Western medicine like myself. There are a lot of strengths in Western medicine, primarily in acute care. Acute care can be, catching a cold, seeing if you need antibiotics or breaking a bone, needing surgery, any kind of trauma. That is very helpful and impactful. An acute problem responds to an acute intervention, a pill, a surgery, a procedure. However, when we're dealing with chronic disease, we can go back many, many years to Sir William Osler, one of the fathers of medicine. And he very intuitively said, it is much more important to know what sort of patient has a disease than what sort of disease a patient has. And I think what he meant by that is understanding what patients are doing on a day-to-day basis in their lifestyle habits contribute significantly into what diseases they have and potentially what therapies they're going to respond to. If you look at yourself as this drawing here in the middle, have you ever had the experience of kind of having yourself and your body cut up into different pieces? If you have headaches, you go and you see the neurologist for migraine headaches. If you have blood, cholesterol, heart problems, you may see your primary care cardiologist. If you have heartburn issues, you may see a specialist, a gastroenterologist, etc. And so we don't see the whole person. We kind of compartmentalize all these different problems. So what tends to happen is that we get a pill for all of these individual problems. And rheumatology is no exception. We focus and specialize in diagnosing and treating over 100 different kinds of arthritis. However, what Sir William Osler is saying is that we should really understand what happens outside the doctor's office visit, what lifestyle factors that may be contributing to all of these chronic illnesses that the patient is experiencing. Specifically, what types of stresses, sleep problems, their diet, exercise or lack thereof, that may be contributing to all of these chronic diseases. Because if we don't, you end up like this pill person here on the bottom right, which I'm sure no one wants to end up becoming. I've seen a lot of patients over my years in practicing medicine who feel that way. And unfortunately, the way we are taught to be doctors, in some respects, contributes to this problem. When you look at chronic diseases, and there are many, there are a lot of things that contribute to it. Genetics, environmental, lifestyle. And when you implement a pill therapy, that really helps address a small portion of what contributes to a chronic disease or the physiology or biochemistry of the problem. However, the majority of what contributes to a chronic disease has to do with environmental lifestyle factors. And unfortunately, chronic diseases like diabetes, heart disease, cancer, arthritis, stroke account for more than 3 out of 4 deaths in our country. And so addressing chronic disease management not only should incorporate pill medications or procedures or interventions, but should also focus on helping patients understand how they can be involved in their own healing and wellness, looking at diet, exercise, stress reduction, improving sleep. Because not only are these interventions cheaper, safer, and oftentimes as or more effective, they can actually turn off some genetic predispositions, which we're going to talk about in a little bit. So chronic disease are often the result of chronic lifestyle choices and cannot be cured by an acute intervention or a pill. We still use pills to treat our chronic problems, but used alone without lifestyle interventions, your chances for success are markedly diminished. Specifically talking about stress, when we talk about physiological or chronic inflammation, chronic pain, diabetes, etc., a physical stress on the body, this can often be compounded by other types of stress, environmental stress, mental stress, psychological stress. Environmental stresses being not only noise or pollution, but sometimes what we eat or put in our bodies, toxic exposures, how you think, your mood, and also what's going on in your life outside of the doctor's office, unemployment, financial stresses, loss of family members, etc., can often compound the physiologic stress of chronic illnesses. And so helping patients identify this and manage them in a more positive way can often be beneficial to physical, emotional, and spiritual health. I want you to sit back and think about how you cope with stress. I hope many of you are not identifying with this lady here whose past work have a lot to do and trying to stay awake by drinking coffee and catching up on a quick lunch that she probably didn't get to eat. Do you try to avoid stresses, eat comfort food, drink, smoke, feel like you're banging your head against the wall dealing with your stresses? I hope not. There are healthier ways to help you deal with stress, which can also be beneficial to your physical health. And sometimes, unfortunately, the stress can be so overwhelming that people sometimes, unfortunately, end up hurting themselves or hurting others. Stress can also have a direct physical impact on the body. And back in 2004, there was biologic proof that chronic, intense emotional strain can make people get sick and grow old faster. And chronic stresses hastened or shriveled the genes or the telomeres here at the ends of your chromosomes. So your cells in your body can age and get sick more quickly with chronic stresses. This actually led to a Nobel Prize for these researchers, Dr. Blackburn, Grieder, and Stozak out of UCSF, Johns Hopkins, and Harvard in 2009. So when we don't identify or don't talk to patients about their chronic daily stresses, we lose an opportunity to make them healthier and reduce the stresses on each individual cells in their body, which may be contributing to increased aging and sickness. Sleep is also very, very important. There are over 100 different sleeping disorders: snoring, sleep apnea, insomnia, sleep deprivation, restless leg, etc. And sleep is required for almost all essential bodily functions, not just your energy, your physical health, but also your mental health, your memory, your metabolic health, your diabetes, your reproductive health. You should sleep about a third of your life, and the requirements of how much sleep are going to vary amongst your age. Unfortunately, half of the elderly, a third of adults have have sleep problems. 15 to 20% are chronic. If you work night shifts, a lot of people don't get enough sleep. And unfortunately, we have a culture that says it's important to lead a balanced life. 8 hours for sleeping, 8 hours for working, and 8 hours for working harder. So sit back and think and assess, how is your sleep doing? And how can you improve it to improve your physical health? Because there are consequences for inadequate sleep from whatever problem. There's been documented proof of increased rates of coronary artery disease and car accidents. Your metabolic hormones that promote weight gain have also been linked to chronic sleeping problems. Your reasoning, your memory, your concentration, your emotional health are all decreased with chronic sleeping. Obesity and other chronic diseases. Neurologic deficits, as all brain neurotransmitters, the chemicals that allow the cells in your brain to communicate, are all negatively affected by poor sleep. And there's also increased risk of depression, anxiety, bipolar, suicide, substance abuse in people with chronic sleeping disorders. The area that I really focus on and I'm concerned about is the increased immune system dysfunction and inflammation that occurs with chronic sleeping disorders, which is why I frequently assess or ask about sleep in my patients. And even cancers are 30 to 35% higher in patients, even if they are thinking that they're sleeping well, taking chronic sleep medications. So there are a lot of chronic medical, physical consequences of inadequate sleep. How are we doing on our diet? On the top here, the whole grains, fruits, vegetables, calcium that we should eat, we're really not meeting our goals. Solid fats and added sugars, oh, we eat way too much. Refined grains, white rice, white sugar, sodium, saturated fat, we eat way too much. This is about how much the daily recommended amount of sodium for a adult is that does not have high blood pressure. It should be a lot less if you have high blood pressure. And unfortunately, common, cheap, readily available foods can have a significant amount of sodium. This one package here of noodles that you can get at any Asian store has more than the 1,500 milligrams per day of sodium that you should eat if you are an adult with high blood pressure. How are we doing to adhere to these dietary recommendations? Not good. And what you feed yourself can actually affect your genes. So these are two genetically identical mice that are fed different diets, and you can see the physical expressional differences, even though they are genetically the same. Sugar tastes good, raises your blood sugar, causes your body to release insulin, which is a hormone to lower your sugar levels, which drops your sugar levels, which make you hungry, which makes you eat more. And it's been shown that sugar can affect your brain in the same way as another addictive chemical, cocaine. So it can often be very, very challenging to get people off or decrease their sugar addiction. Fortunately, we are not controlled by our genes. And this is very well documented in the Amish population that can have a genetic predisposition to obesity. However, because of their lifestyle choices, especially walking a lot, 7,000 to 10,000 steps a day, they oftentimes don't develop the chronic medical conditions associated with obesity. Back in 2007, obesity overtook smoking as the global health threat. And it's no wonder, because of all our modern day conveniences, that it's very easy to get food and very easy to get obesity causing foods. And our inactivity, if you sit for more than 5 hours a day, the negative health consequences would be equal to that of smoking a pack and a quarter of cigarettes a day. So this has often led to the phrase, sitting is the new smoking. So if you are sitting in traffic, commuting, that's also a negative impact on your health. So if you can think for a moment of yourself as a tree here, and let's say some of the branches of the tree were sick. This branch had arthritis, this branch had heart disease, this branch had, stomach problems. If you can think of ways to make the tree healthier, some people may say, oh, put fertilizers or chemicals in it. That's another way. Another way would be cut off the sick branches or surgery. But what I would encourage you to do is think about ways in which you could nourish the tree, give it good rest and water and sunlight, healthy things that will allow the tree to heal itself. Making these choices of healthier options is oftentimes cheaper, easier, safer to do, but may take more time, energy, planning. but you can put yourself or heal yourself with these interventions and rely less on pills and hopefully less on surgical interventions. I discovered this and had a very pleasant experience when I was practicing in Fremont of holding shared medical appointments where patients got together in groups, learned about these different concepts, and actually began the process of writing their own health and wellness prescription. So that's the first part of the talk. And now I'm going to apply this integrative holistic approach specifically to lupus. When you talk to rheumatologists about lupus, what we're really concerned about is not just arthritis, but the significantly increased risk for heart disease. That's why I have a blood vessel here that's getting narrower and narrower. Because although we're generally talking about young women, 30s to 50s, they have a significantly higher rate of heart disease problems compared to women of their same age without lupus. And this butterfly, purple butterfly symbol is commonly used to remind patients that everyone's lupus is different. We can learn from every patient who has their own story to tell. So when you think about what causes lupus or SLE here in the down here in this bubble here, I often explain it to patients this way. There may or may not be a genetic predisposition that is oftentimes triggered by ultraviolet light, sometimes medication, stresses on the body like smoking, infection, or pregnancy, which can then cause your immune cells, your T cells, B cells to be more autoimmune, or instead of protecting the body, attack the body. Oftentimes, after diagnosing a patient with lupus, will often then assess their lifestyle habits, because these can often be potential treatments to decrease the triggers and decrease the cascade of either causing or developing lupus. What triggers lupus? Well, that's the million-dollar question, and everyone is different. Some common causes would be pregnancy, feeling tired or stressed out or worn down, infections, stress like sunlight or infection. There's sometimes medications that can trigger something called drug-induced lupus. Oftentimes people with autoimmune predispositions often have low vitamin D, which can also be associated with weak muscles, weak bones, and increased infections, in addition to increased autoimmune diseases like lupus. Ultraviolet light, physical, psychological stresses, unhealthy habits. We also mentioned the sulfa-like drugs. So this is a very interesting study, and what we found is that before the time of diagnosis here at time 0, okay, you can see all these different autoantibodies, ANA, ROLA, antiphospholipid, double-strand DNA. And this is where I see a lot of my consultations. Before you can actually definitively diagnose someone with lupus, a lot of primary care doctors and even rheumatologists sometimes will order these blood tests, and patients get really stressed out about their results. But I often try to reframe this discussion and tell patients that this is a yellow warning light, and it's an opportunity to make healthier lifestyle choices and changes. Oftentimes, this opportunity is missed by most people and even doctors because it is dressed in overalls and looks like work. But hopefully, with the recipe that I have that I'll teach you, this will not be so burdensome. And I tell patients this is actually lucky that they don't have lupus. We're not diagnosing them with lupus. All they have are some mild possible related symptoms and an abnormal blood test. And this is an opportunity. And what we need to do to be lucky is to help patients prepare. So luck is what happens when preparation meets opportunity. So if you look at this timeline, susceptibility of a disease like lupus, maybe you have family members with lupus or autoimmune disease. There may be some exposure or trigger oftentimes maybe post-pregnancy, post-infection. You may have some subclinical disease, mild joint pains that are intermittent with the onset of symptoms and then a formal diagnosis here. Anything prior to the formal diagnosis, ideally, if possible, we would like to be able to treat with healthy lifestyle interventions. The later on in the time course of obvious and hopefully maybe not, but sometimes moderate or severe disease manifestations, that would be more appropriate for typical medical interventions that we're going to briefly discuss in our talk. And we'd like to focus on this side of the spectrum because, as we all know, an ounce of prevention is worth a pound of cure. So really looking at your lifestyle habits, making a wellness prescription is going to serve you much, much better in the long term. The most fun and the most appreciative patients that I see are typically the patients that I see before a formal diagnosis can be made. And we use that opportunity for them to get healthy. And I see them for a couple of visits. And because they do such a good job of managing their stress, exercise, nutrition, they don't need to see me or come back. Usually around the holiday times, I get cards from patients who I used to see that just tell me, thank you so much. I'm feeling much better. I haven't developed anything like lupus. I don't think I need to see you. I know how to get in contact with you if I need to, but I just wanted to tell you I'm doing well and thank you. And that's really the joy that I get from practicing integrative medicine, is to help patients live their best and healthiest life. Why do we do this? Because there are a lot of downstream negative effects of lupus. I show this slide because oftentimes people with arthritis struggle with their weight as well. Same thing can be said with lupus. There's a very high association with lupus and cardiovascular disease, blood pressure, cholesterol, hormonal problems, memory problems, sleep problems, muscle problems, etc. So when you're seeing a specialist for your lupus, making sure that they pay attention to any and all associated medical problems becomes very important as well. Because sometimes the treatment for lupus may not necessarily need to be a medication, but it may be addressing stress or sleep problems that are causing your lupus to flare. So don't miss the forest for the trees, or look at the patient as a whole. Don't individually dissect the patient into different organ systems and only focus on that. Step back, look at the big picture, and make a rational decision about potential interventions or treatments. In addition to the traditional cardiovascular risk factors listed here for lupus, patients, or even women with lupus, have other risk factors as well. And this is why, even though patients with lupus are generally young, they have a significantly increased risk for heart disease compared to women of their same age without lupus. If you want to get a general sense of what your risk factor should be, there's something called the Framingham risk calculator. I'm going to put up in the chat a list of these references so you can look at it on your own later. You just plug in your age, gender, cholesterol, if you smoke, in your blood pressure, and it'll calculate it for you. But if you have lupus, you need to multiply this risk by 2. Hopefully in the future, there will be more sophisticated blood tests. And this is a reference of a small cohort of patients that were followed for 10 years. So we're getting and developing tests that may actually help us predict who with lupus is really going to need to be focused on to lower their heart disease, cardiovascular risk. So we're getting there. So what can you do to customize your own wellness plan? I'd like to encourage you to think about what's going on from the perspective of stress, exercise, nutrition or diet, your sleep, and your social engagements, who you interact with. And hopefully, this will start to make sense. When I came back to Hawaii, I was teaching the sense mnemonic to some of my patients here. And as I was writing this out, this lady said, "Oh, Your mnemonic is Sensei, which is teacher in Japanese. So because I like that, and I want patients to be their own doctors or their own senseis, I added an I. And so the I is, what is your inspiration or motivation for making these changes? Because oftentimes it can be a struggle making sure that you have time to get exercise, eat well, sleep well, manage your stress, engage with positive people. So when the going gets tough, if you have already thought about why you're doing this, and your inspiration or motivation should not be, my doctor said I needed to do this. That's not very inspiring or motivating. That's an individual decision to hopefully get you on the path and the roadway to where you want to be, which is hopefully someplace sunny, warm, and enjoyable. So from the perspective of stress, there are many different mind-body interventions for stress management: deep breathing, relaxation, meditation, guided imagery. If you work with a therapist or a counselor, asking them if they do cognitive behavioral therapy. Cognitive behavioral therapy is a technique that psychologists use that not only can help with stresses, but also sometimes be used if you have chronic insomnia. So if you're having difficulty sleeping, looking for a therapist that offers cognitive behavioral therapy for insomnia can often be very, very helpful. Does this actually work? Yes. There have been documented reduced rates of death, heart attack, stroke with meditation. This is the events of heart attack, strokes, and death with people just provided with information. Hey, read about this. And this is a 47% reduction in death, heart attack, and stroke in people who actually practiced this meditation. So knowing about it versus actually doing it, there's a huge difference in the outcomes that we are following, very significantly being death, heart attack, or stroke. Because of this, the American Heart Association actually recommends meditation to lower blood pressure, death, heart attack, and strokes. And you know what? 100% side effect free. There's no copay either, no prior authorization needed. Also, and a very important way to reduce stress, especially for patients with lupus, is to protect your skin, because the UV lights can actually be very stressful to your skin and can exacerbate or cause lupus. So looking at your SPF 30 or higher, making sure you have both UVA, UVB protection as well, to decrease the amount of sunlight that can be stressing your skin, and your total body lupus becomes very, very important. Don't forget, if you have an FSA account, oftentimes, although this can be expensive, you can defer some of these costs to your FSA account. So if you're not aware, ask your employer, your HR person, hey, do we have an FSA option? That can oftentimes help you pay a little bit less for these products. If you're going out to support the different Lupus Foundation walks, in addition to sunscreen, make sure you have protective clothing, long sleeve, wide brimmed hats as well. And I'll also, at the end, put some links for the Arthritis Foundation exercise classes that you can actually do at the comfort of your own home. So you can log in online and do those as well if you don't want to get out. Looking at your diet, the standard American diet, or SAD, is highly processed, heavily protein, and very unhealthy because very, very few whole grains and vegetables. And the whole grains and vegetables that they do include are unrefined, meaning they take out all the nutrients. So as I like to say, junk in, junk out, healthy in, healthy out. And there's a rationale for eating healthier. So if you traditionally eat a standard American diet where they take out healthy minerals and nutrients, you may need to supplement that. Or the other option is to not eat a standard American diet. You may also have increased nutritional requirements if you have malabsorption or your metabolism is high because of certain diseases, if you take certain medications that'll deplete vitamins and minerals, if you are stressed or consuming alcohol, you may need additional nutritional requirements. Very similarly, when women go through pregnancy, they are routinely prescribed folic acid because this is very important to decrease birth defects, neural tube defects. So looking at your diet is not just a simple what do I want to eat? It's what do I really need to eat to optimize my body metabolism and chemistry. Next weekend is going to be the 10th anniversary of a very inspiring and educational documentary series called The Weight of the Nation. It premiered May 14th, 15th in 2012, and it basically highlights the challenges of the obesity epidemic in the United States. If you haven't heard about it, I will have links at the end of the talk that you may want to click on to learn about the different challenges and potential solutions if you are struggling with the weight yourself. I can't believe it's been almost 10 years since this first came out. I often get asked about diet, and this is a very tricky and personal question to answer because, when I was practicing in California, recommending and suggesting a Mediterranean diet was a little easier. When I moved to Hawaii, not a lot of people are familiar with the Mediterranean culture or would want to switch to this diet. So I had to kind of shift and think about a more Asian-friendly diet plan. The key really for diet plans are making small incremental changes that you are going to stick with over time. So being born and raised in Hawaii, white rice is a staple. You eat white rice for breakfast, lunch, dinner. When I moved to California in 2000, it was a little bit easier for me to transition from white rice to brown rice and eventually even off of rice totally. Now that I'm back here in Hawaii, white rice is so prevalent around me that I'm eating a lot more of it than I did when I was in California. But again, making sure that this is something that's going to be economically and it's going to be, agreeable to your palate. Because the last thing you want to do is spend a lot of money on a diet that you're going to stick with for a month or two and revert back to your old ways. So take your time, make small choices that you think you can stick with and go from there. More specifically with your diet, focusing in on increasing your omega-3 or fatty oils from fish, because it's been demonstrated in many studies that eating salmon, mackerel, anchovies, sardines, or herrings and getting back to a more primitive omega-6 anti-inflammatory, pro-inflammatory to omega-3 ratio is cardioprotective. The standard American diet is very pro-inflammatory, a lot of omega-6 pro-inflammatory relative to omega-3. The latest dietary national guidelines recommend 450 to 500 milligrams of omega-3 fatty acids per day, and those with heart disease should contain about a gram, preferably from fatty fish. This may or may not be something that people want to do, and there are FDA-approved omega-3s that you can get through prescription. Some of the side effects include the aftertaste, dyspepsia, etc. As you increase your omega-3 level, we've been shown to decrease your risk for cardiac death in the Physician's Health study. I really like this company, Neurologics. They have rheumatologists that are on their board that actually look at and review data with regards to supplements, vitamins that are specifically beneficial for patients with rheumatic conditions. So if you want to check out their website, I'll have the link later at the end too. They have omega-3. They also have vitamin D. Vitamin D is a steroid hormone made by your skin when you're out in the sun, and it has a lot of bone and also cardiovascular and immune system benefits. When your vitamin D levels are low, you not only have weak bones and muscles, but you also have more autoimmune diseases like lupus, multiple sclerosis. And there's actually been some clinical trials showing that a higher level of vitamin D in your blood can actually help control some mild lupus symptoms. So if you have lupus, Especially if you're on steroids, have weak bones or fractures, if you've never had your vitamin D level checked, make sure you get it checked. And if your vitamin D level is less than 40 to 50, make sure you pick up some vitamin D3 to get that level up, because that could actually be what can make your actually lupus better controlled as well. I generally prefer D3 because it's 4 times more potent than D2. D2 is a pill that I often see primary care physicians prescribing for patients. They take a big dose once a week. I generally prefer the vitamin D3. And there's also this hormone DHEA, which in conjunction with conventional treatments for lupus may actually improve disease activity and improve quality of life, bone mineral density, decrease the flare of lupus, decrease your need for steroids. These are the trials here. Dr. Michelle Petrie is our national lupus expert that a lot of these recommendations are coming from. And again, Theralogics makes a DHEA 25 and 50 supplement that has been tested for accuracy and purity. So that may be something that you want to look into as well. As far as potential side effects, pretty similar to placebo, except for maybe acne. And obviously, the higher the dose you go, the higher the level of potential side effects. And it can be used to support female fertility as well. If you do have lupus and you want to become pregnant, please, please, please make sure you let your rheumatologist know ahead of time, because the best time to get the best time to get pregnant if you have lupus is when your lupus is quiescent and very well controlled. If you get pregnant while your lupus is active, you may have a unsuccessful pregnancy, a complicated pregnancy, or God forbid you lose the pregnancy. So make sure you talk to your rheumatologist, your gynecologist, and your primary care when you're thinking about getting pregnant, because we really want to optimize your chances for success. The reason why DHEA is really important is because here in the upper left, oftentimes it can be decreased because when you're stressed, your body shunts the normal cholesterol metabolism down this pathway to make the stress hormone cortisol. So if your cholesterol metabolism is being shunted to chronic stress, you're not going to have enough DHEA for your normal hormone production here. Now, if you do have hormone-sensitive cancers, PCOS, severe heart or liver disease, DHEA may not be appropriate for you. So again, talk to your rheumatologist. If you have an endocrinologist or a primary care physician, make sure you talk to them before you contemplate getting these supplements as well. So again, from an integrative holistic standpoint, you may want to add some odd supplements, omega-3, vitamin D, and DHEA. With any and all of your supplements, you want to make sure that they're being third-party adjudicated or reviewed for purity and safety. These are different organizations that do that. Turning to medications, we still use, and I still use prednisone because it is one of the FDA-approved medications for lupus, but it causes eating problems, shaking, anxiety, bone thinning, weight gaining, infection, heart disease, so you can never sleep again medication. It has a lot of potential side effects. So I try to teach patients that the P in prednisone stands for poison, and this is what I learned from Michelle Petrie, our national lupus expert. And even low doses of prednisone, greater than 6 milligrams a day, has been associated with increased organ damage in patients with lupus by 50%. And if you take more than 7.5 milligrams of prednisone a day for 3 months, you can have major bone loss or osteoporosis. So even though you're taking what you think sounds like a low dose of prednisone, it may still be doing a lot of damage to your body. So these are the first medications that were approved for lupus: aspirin in 1948, prednisone in 1955, and hydroxychloroquine or Plaquenil. It was not until 2011 that we got our next approval, Benlysta or belimumab. And last year we got 2 new drugs, lupkynin and safnilol, that are FDA approved for lupus. So before 2011, we really only had 3 drugs that were FDA approved, and they help and they work, but they also have potential side effects and work very good for really aggressive lupus that can involve your kidney, your brain, etc. Prior to 1955, the 5-year survival for patients with lupus was less than 50%. So in 5 years, if you had lupus before 1955, less than half of those patients would be alive. More recent data from the early 2000s, the average 10-year survival rate for lupus is now greater than 90%, and the 15-year survival is about 80%. So we made significant improvements, hopefully not only in disease survival, but quality of life for patients with lupus. And hopefully we will continue to improve. The H in hydroxychloroquine is that hydroxychloroquine or Plaquenil is very, very helpful. These are some of the helpful attributes for hydroxychloroquine: reduction in lupus flares, reduction in lupus organ damage, reduction in cholesterol, reduction in blood clots, improvements in survival. It triples the beneficial effect of another drug we use to treat for lupus called mycophenolate, and it can prevent seizures in lupus. So it has a lot of beneficial effects. More recently, the ophthalmologists have been using a sophisticated tool to check for Plaquenil depositing in the back of the eye. Before you decide to stop your Plaquenil after having an OCT with your ophthalmologist and they say, oh, it looks like maybe you're developing some Plaquenil retinal toxicity, please, please, please talk to your rheumatologist first to see if they agree. Because potentially you can have a lupus flare simply by stopping your hydroxychloroquine. Belimumab or Benlysta has been approved to treat lupus since about 2011. It's used to treat active antibody positive lupus who are already on standard therapy. So you have to be on a starting drug for lupus first, and if you're still active, then you can add Benlysta. Initially, there were 2 clinical trials looking at almost 1,700 patients that demonstrated that adding Benlysta decreased the lupus disease activity when compared to the standard treatment alone. Unfortunately, African American lupus patients did not seem to respond as well to Benlysta as the other patients as well. And how it seems to work is that Benlysta blocks the bad antibody production B cells and can that can cause the different manifestations of lupus. Benlysta is a 1-hour IV treatment, or is now also available as a weekly injection. The IV has a loading dose and once every 4 weeks, and there's a lot of information and resources from GSK, the company that makes Benlysta, to help make sure that you're covered, that it's affordable, etc. So if you're thinking about it, please talk to your rheumatologist for more help. The newest FDA-approved medications are one, an oral lupus. It's a pill you take twice a day. Both of these you add on to lupus treatments. The lupus is not recommended if you're taking cyclophosphamide or Cytoxan. And the IV Safnilol or anifrolumab, it's not known if it's effective in very severe brain affecting or kidney affecting lupus, but it is quite effective for skin oral manifestations of lupus. So talk to your rheumatologist. These are the other non-FDA approved treatments for lupus: methotrexate, leflutamide, azathioprine. It really depends on what your manifestation of your lupus is. It's nice to have options. If you do have Raynaud's associated with lupus, stress reduction, lifestyle modification, and sometimes blood pressure medications can be helpful. And again, also making sure that the rheumatologist, primary care, or cardiologist is assessing for coronary artery disease, checking your cholesterol, your blood pressure, etc., to lower your cardiovascular risk factors, because cardiovascular disease is so prevalent in patients with lupus. So to take control of your lupus, hopefully I've given you a good sense of what you could do. So I often tell patients I have a YouTube video link that goes into depth about this Sensei Approach, which I'll have in the chat box for you later. But I tell patients to watch the video, write Sensei on the left-hand side of their note-taking sheet, The first S being stress management, E for exercise, N for nutrition. The second S for sleep, E for engagements. So engagements are like your support systems. I really like the Lupus Foundation of Northern California, their buddy program. I suggest that to patients because talking to other patients and seeing how they conquered their challenges in dealing with whatever that they have regarding to lupus is often very, very therapeutic and very helpful. And also getting people to think about what inspires or motivates them, or why are you working towards wellness? Why do you want to be healthier? So the purpose of the videos are to explain why these concepts are important, but also get you thinking about how you're going to customize that for yourself. Because again, your inspiration or motivation should not be, well, my doctor says I need to meditate, exercise. There's not a lot of motivation when it's, that's the reason why you're doing it. Because when things get hard, that's not really motivating. So if you do decide to watch these videos that I'll put up on the chat link at the end, take some notes. And once you take your notes, put it on your refrigerator, put it in your bathroom to remind yourself and check in with yourself on a day-to-day basis. Because there is a lot of interest in how these interventions are going to help patients with lupus live longer and better lives. And if you want to share your Sensei program, that would be great. The discussions and support groups, I think, with the Lupus Foundation will be a great place to share it with other patients. Again, just a reminder, other tips, if you're considering being pregnant, talk to your doctors before you start trying. And if you smoke, because of the already inherent risk for heart disease with lupus, talk to your primary care, talk to your rheumatologist about trying to quit smoking. Educate not only yourself, but your friends and family about how they can be helpful in helping you live well with lupus and decreasing your lupus triggers and flares. There are apps available. I haven't found one that patients tell me that they really, really like, but it's another way of keeping you engaged and thinking about your lupus. I really like the Us in Lupus project. It's another link I'm going to have for you. They have different questionnaires that you can go and you can fill out and you can think about before going to see your rheumatologist. I used to give this out in my office to my lupus patients when I'd see them, because sometimes we often forget to ask about these things. And if we forget to ask about them, then we can't really make a plan to address them. So check out the Us in Lupus website because they have a lot of tools to help increase your communication with your healthcare team, your primary care, your rheumatologist, and the other specialists that you're seeing. And this is something that I'm going to be very interested in and following over the next 3 to 5 years. It's the STRIVE program, which stands for Systemic Lupus Targets Related to Improving Vital Endpoints. So it's based out of NYU. It's a lupus registry of 900 patients. There's a collaboration between Dr. Ismerly and Dr. Gold. And the project is going to explore the potential association between regular physical activity and patients' perceived stress, their lupus flares, hospitalizations, and if other stressors, poverty, environmental factors are playing into it. So this is a very great undertaking, but I think will provide us a lot of useful information with regards to what can potentially lifestyle interventions do, either both positively or negatively. I would guess that the patients who have less stress, who deal with their stress better, who have better access to a healthy diet and better sleep and a healthier, cleaner living environment and have lupus are going to do better. And unfortunately, those with more stress, whether it be physical, social, psychological, financial, less resources for a healthy diet, don't sleep well, etc., are going to have, unfortunately, worse outcomes with lupus. So it's nice to see that integrative healthcare approaches and concepts are being looked at and see how they affect chronic diseases like lupus. So I will put up these links in the chat box. Lupus Foundation Northern California, I'm sure you're all aware about Us in Lupus, the Arthritis Foundation exercise videos. There's a great website called Mother to Baby. So if you do get pregnant, on these immunosuppressive drugs and you want credible information about it, Mother to Baby is really, really very useful, very helpful. And they also have a phone line that you can call or email. If you're interested in the supplements, I'll have a link there. I have a link to my YouTube videos. I also did a podcast for Dr. Pedia if you want to learn more about my practice, also my telemedicine practice. These are the links for the Weight of the Nation, about our obesity epidemic. And if you're curious about the Framingham cardiovascular risk calculator, I'll put that right now in the chat box.
Thank you so much, Dr. Shibuya. This was so informative and very comprehensive. Now we'll open the Q&A portion of the event. We will begin with the questions that were asked during the presentation. Feel free to ask additional questions. We'll try to get through as many questions as we can live, and we'll email you answers to any questions that we were not able to get to today. So one question that was from earlier that I'll just pose to you, Dr. Shibuya, if my rheumatologist will not provide guidance for integrative or holistic treatments because they are not proven, how can somebody navigate that? Where can they kind of start to look for more information, or perhaps a doctor that can help them?
Yeah, that's very unfortunate. There is a professional organization that I belong to called the the Academy of Integrative Health and Medicine, or AIHM. So if you Google AIHM, they have a physician finder, and these are medical Western trained doctors who respect, learn, and collaborate with other practitioners, with Chinese medicine, herbalists, whatever, to provide the best care. Because sometimes we are not going to have randomized double-blind placebo-controlled trials that most Western physicians look for as far as proof of concept of benefit. Unfortunately, there are not a lot of rheumatologists that are interested in integrative medicine. There's also a fellowship that you can take as a provider through the University of Arizona through Dr. Andrew Weil. I'll see if I can find those links here. So you can kind of do the start there.
So is
yeah, that's
that
hard.
For a patient can take that?
You have to be some sort of allied health professional. You don't have to be a doctor. You could be a pharmacist, you could be a therapist, but you need to be a healthcare provider in some sorts.
Okay, great. And you talked a lot about lifestyle medicine, just the things that patients can do to help themselves as far as exercise, diet, stress management. If looking into a lot of this information is new for someone, what do you think would be the most impactful, or maybe the best place to start?
So I generally tell patients that they need to start looking at their stress and their sleep, because oftentimes if you are too stressed out, you can't learn or apply anything else. And if you're not getting good sleep, you're not going to have the energy to exercise. So I often tell patients to really assess their stress and their sleep. And if they can do that with their primary care, great. If they need help with that, seeking out a counselor, a therapist. So I just put in the chat the link to the Find a Provider through the AIHM. So you can look under primary profession. They have nurses, they have nutritionists, they have physician assistants, they have yoga therapists, you name it, they got it. And you can put in your city or zip code.
Mhm.
I don't necessarily know if they're going to participate with your insurance or not, but at least you can get a sense of the type of practitioner and where they practice. Another helpful resource is psychologytoday.com. I'll put that link there. So this is a link for patients to find therapists, counselors. You can search not only by zip code, you can search by area of expertise, if they offer cognitive behavioral therapy, if they see patients for depression, anxiety, insomnia, whatever. So getting some professional help. And what I tell patients is, go and watch my videos on YouTube about the stress part. And then if there's questions or you're interested in something that I mentioned there, then talk to the therapist about it. And what I found is that a lot of times the patients are like, oh, I didn't know that this could give me health benefits. And the therapist or provider that they're seeing is oftentimes pleasantly surprised that the recommendation is coming from their medical doctor. And so once we form a collaborative team that is going to help the patients work towards wellness rather than, because the common complaint I get is, well, I just keep going to see doctors and they keep throwing pills at me and I'm sick of seeing pills. And I said, yeah, I get it. But if you are interested in stepping back from that and using alternative modalities, then working with an integrative practitioner, working with a therapist is very, very helpful as well. One of my dear friends and colleagues, who's actually back in the LA area, she practices integrative sleep medicine because oftentimes I see patients who, their lupus is pretty well controlled for the most part, but could be doing much better if we're able to get them sleeping better. Sometimes it's a logistical problem. Like I had a patient that I used to see in Fremont. Her lupus is pretty much well controlled, but would flare from time to time because she wouldn't be able to get good sleep. And once we were able to address her sleep issues, magically her lupus got better. We were able to taper off her prednisone. So thinking outside the box, and if you're not able to find an integrative rheumatologist or even an integrative primary care physician, I think you can do a lot, just kind of with the basics that I have on the video that I put. Because to be really honest with you, I've yet to find a patient with a chronic disease that the Sensei approach does not apply to. It doesn't mean everyone's successful in doing it. Don't get me wrong, it's not easy to do. But if you are motivated and you're dedicated and you are, committed to making these changes and sticking with them, you will see the benefits. Now, I'm not saying that you do all of this and your lupus is going to go into remission, you come off of all your medications. That's not what I'm saying. I'm saying that, rather than having moderate to severe lupus, maybe you have mild to moderate. Maybe instead of taking 20 milligrams of prednisone, maybe we can get you down to 5 with other medications. So it's a nice, I see it as additional tools, because if your doctor doesn't have these additional tools, you're stuck with just cycling through the medications, which can sometimes be dangerous and expensive, and can be scary for patients. And so I really enjoy learning about and talking to patients about these other potential interventions. One, because a lot of times in our busy practices, we don't do it. And so patients are pleasantly surprised that I do this. And it's nice to be able to help patients when other people have not been able to. I do see patients primarily in all over California and in Hawaii. Soon I'm applying for my license in Texas. So hopefully there will be increased access to rheumatologists, if not through in-person, but at least through telemedicine, because some of my colleagues in the past who are rheumatologists, they see the benefits of it, but they kind of tell me, well, can you teach me how to do this?
Mhm.
And I'm kind of like, well, I've been going to conferences, learning and experimenting in my private practice with my patients to see what works, what doesn't work. And it's not something that I can go like, here, do it. It's something that you really need to commit to
Yeah.
learn, to experiment, to do, and to try. I am talking to a couple startup companies that are looking at bringing kind of what I did in my practice through the shared medical appointments
Mhm.
virtually online. So you know how we're having like a group meeting now. So rather than it being just one-way didactic, we have group discussions, group participations. Because what I did in my office was once your diagnosis was made and you're chronic in your disease management, this lifestyle intervention is not for people acutely newly diagnosed or flaring. Okay. That's when you need to do your regular Western medicine. But once things are stable, patients would agree to sign up for basically 4 classes. We spread them out about 6 weeks apart. The first class I would teach about what stress is, how does it manifest, what are some healthier ways to cope with it. Um, so we would do stress, then we would do exercise, then we would do nutrition, and then we would do sleep. And so hopefully after the 4 visits, getting patients to really think about what they can be doing, they share their, successes or failures with the other participants, they come to a new understanding of what it means to work towards their wellness and be a part of their healthcare. And it was a very eye-opening and learning experience for myself. For the stress class, as people were getting ready, we would screen for depression, anxiety, and post-traumatic stress disorder. And I clearly remember, and I'll never forget, the 3 out of the 15 patients who signed up for my first stress class screened positive for post-traumatic stress disorder. The first lady, so after the group, we met individually for a follow-up visit. And so when I walked into the room for that first patient who screened positive for PTSD, she literally broke down in tears and started crying. And I wasn't expecting anything like that. And I kind of, asked, excuse me, what can I'll try to understand where these emotions are coming from. And she literally said, no one's asked me these questions before. And so fortunately, when I was seeing patients individually, my neighbor from upstairs, who was a pain psychologist, was leading the group discussion. So people got to meet a psychologist. And she, like the psychologist, made an appointment to address and deal with her PTSD. And you know what? Amazingly, her wear and tear arthritis that I was giving her moderate, strong pain medicines for got better, and she never needed them anymore.
Mm.
So even for practitioners like myself, who understand the importance of practicing integrative medicine, this is still a challenge to do, even when you have the best intentions. I medicalized her pain. She came to me, she said she had back pain, knee pain, neck pain, whatever. We got x-rays, blood tests, and said, oh yeah, okay, you have arthritis on your x-rays. That's what must be causing your pain. What I learned from this experience was pain can be either caused or amplified by other factors: depression, anxiety, sleep disorders, PTSD, etc.
Mhm.
And so if you're not assessing for those things, you lose the opportunity to make some helpful suggestions. And that happened 2 more times that same day. And so I was like, okay, someone in the universe is trying to teach me a lesson.
Mhm.
The lesson being, okay, make sure that you are a general internist first. You don't just attribute the patient's complaint to the obvious thing in front of you.
Mhm.
Another way of saying that is, you know, I'm thinking of an animal that gallops and has 4 legs and has a tail that it wags. Most people think about a horse, but if I say that horse has black and white stripes, it's obviously not a horse, it's a zebra. So it depends on what you're conditioned for, what you think is most common to have for the patient to have to be able to help them. Being that depression, anxiety, sleep disorders, PTSD is very, very common, it behooves us as practitioners helping patients manage their pain to look for these things. Because if we don't, that's a whole lost opportunity to help patients get better. Patients may not be ready to address these, and that's okay. But building a healthy relationship of trust, respect, mutual understanding of each other, and keeping the lines of communication open, I think will be the best opportunity for creating a successful relationship.
Yeah. And I'm hearing you speak a lot about the mind-body connection as well, which is a big part of integrative health. And so are you making a lot of referrals when you do see
Mhm.
that maybe a patient has more of like a psychological component?
Yes, yes. I ask if that's already been addressed
Mhm.
with their primary care and referrals. Sometimes it is, sometimes it's not.
Mhm.
So if it's not, then I kind of step in and help the primary care doctor out. Or if patients are self-motivated and interested, I refer them to the, psychologytoday.com website that I put up in the chat, and hopefully they can find a provider. Because again, it comes down to the personal interactions. Like, how comfortable are you with this provider? Some people tell me, I wasn't really comfortable with that therapist. I didn't want to talk with them. They didn't seem very interested in me, or, so that's not a healthy relationship for
Mhm.
them to
Mhm.
invest their time and money into. So hopefully finding a provider that they click with, that hopefully accepts their insurance, that provides the type of therapy that they are, interested in. There's also another good resource.
Please just make sure you're sending it to the group because a couple of them just came to me as the host. And so
Oh, okay.
I did repaste them, but please, yeah, just make sure it says to everyone. This is
And
so many good resources that you're sharing. Thank you.
there's also this is a link to a YouTube video, um, Headspace Guide to Sleep.
Mhm.
So it's an intro to, if patients have Netflix, you can find this documentary series on sleep. And you can watch it, and I really like it because it goes over how to get good sleep, what are some common myths, what are the research showing, but also at the end of each segment, they have a stress reduction, sleep inducing exercise.
Wonderful.
And so that's another way that patients can get involved themselves
Mhm.
with regards to hopefully sleeping better. Because a lot of times people say, yeah, I sleep well. And I say, are you taking any sleep medicines? And they're like, oh, yeah, I take my Ambien.
Mhm.
Um, that's, not healthy.
Mhm.
Depending upon the sleep medications, has a lot of negative side effects. Uh, and I'm also going to put in the chat this other link. Stanford has a really, really good stress reduction cognitive behavioral therapy resource called PAM, or Pause a Moment. So I put the link there,
Mhm.
because again, that can be, if you can't find a therapist, if you prefer to do it on your own, um, this is a very well researched, well documented, very efficacious um, kind of tool to help you assess um, what's going on with your stress and hopefully get you feeling and functioning better.
Mhm. Yeah, so many people cite stress as, maybe what triggers
Yep.
the symptoms or brought on their lupus in the first place. Do you find that to be the case?
Yes,
Mhm.
yes, yes, yes. Also for other kinds of arthritis too, psoriatic arthritis, ankylosing spondylitis, rheumatoid arthritis. So in my history taking, because a lot of these chronic medical problems and arthritis kind of contribute to weight gain, one of the questions that I often ask patients is, what is besides what's your current weight, what's your highest weight? And what do you think is your most reasonable body weight?
Mhm.
So, patients say, well, right now I weigh 200. I used to be 250, but I was really healthy in 2010 when I was 150 pounds. So then my follow-up question to that is, I want you to think back to 2010 when you weighed 150 pounds. With regards to stress, exercise, nutrition, sleep, all these different categories, what's different between then and now? Or what's different between when you were 150 and when you were 250? And patients often go, well, yeah, when I was at my highest, I had lost my job, I got divorced, I had, limited financial resources, I wasn't sleeping well or whatever. And so that highlights to them the importance of these interventions and hopefully gives them some insight into how to get back to where they want to be. Now, sometimes that's possible, sometimes that's not. A frequent response is, yeah, I used to be 50 pounds lighter when I had no kids. And I'm like, well, I'm not saying you got to get rid of your kids, but the stresses of you having to deal with the kids is probably what's contributing to it. And so if there are resources or ways, just for me personally, in order to do this talk, my brother is helping me out by watching my son right now. So, thinking about ways of having less stress, time to exercise, eating health, making better eating choices, getting better, not only quantity, but quality of sleep is so vitally important. And I also tell patients, it's like, the doctor that's going to make you the healthiest and the best is not me. It's not your primary care doctor. It's not your other consultants. It's you. You are your doctor. I spend less than 0.5% of your total life time with you in your appointments. You live with yourself the 99.999% of the time else. So you know what's going on with your life with regards to stress and exercise and nutrition. And so making people aware, but also mindful and a little bit more responsible for that is the purpose, the intent, and the way that these interventions become helpful.
Yeah.
Because if you watch the video, you take some notes and you put the notes in a drawer and you never look at them again, I guarantee you're going to forget and you're not going to do what you wrote on the paper. So watch the video, customize your own Sensei wellness plan, but then put it somewhere that you're going to see it. Put it on your bathroom mirror, put it on your refrigerator, put it somewhere, put it on your phone as your screensaver. I don't know, whatever works for you. Because in the few moments of the day when you have time to think and reflect, that'll be your reminder. And the more mindful you become of these interventions, individually, each component may not lead to a significant benefit, but together they become very powerful. And I use myself as an example. And so, I've always tried to pay attention to diet and exercise my whole life. I've never been obese, but I've, been a little overweight here and there. And I used to diet and exercise like everybody, and your weight kind of fluctuates. And I could never figure out why. It was not until I actively paid attention to and was mindful of reducing my stress, sleeping better, and also engaging with the Academy of Integrative Health and Medicine practitioners focused on wellness, in addition to doing the diet and exercise, then my body is like, okay, great. I have less stress cortisol hormones. I have less hunger hormones because I'm sleeping better. I have more positive reinforcements and supports from the Arthritis Foundation, from the Lupus Foundation, from the Academy of Integrative Health and Medicine, in addition to diet and exercise, that my body just started to naturally start to heal itself and drop the weight. And so I tell patients, people who do well and keep weight loss off by simple diet and exercise usually means they manage their stress well, they're sleeping well, and they have a lot of positive social supports. So they're already doing the other stuff in the Sensei program. That's why they just need to focus on diet and exercise. For the majority of us, yes, diet and exercise are important components, but the people I worry about the most are the people who tell me I'm not stressed. And I'm like, are you kidding me? We've been living in this pandemic for the past 2 years and you have no stress? Those are the people who I worry about, maybe not so aware of what I actually mean by stress. And so that's where the group appointments, for these classes become very helpful, because we start to get people to think about, well, there's not only physical stress from illness, there's mental stress from, how you're thinking or your relationships, or sometimes it's financial, the financial burdens of living through this pandemic, or your current work or lack of work situation. There's many opportunities for stress to manifest itself. And so getting people to be very mindful and open to thinking about these things is the challenge. And it's hard to do it in a 5 to 7 minute appointment with your doctor. I mean, we've spent over an hour talking about these things, and that's the added benefit of doing it with a group. Because I would say this to anyone in the group, and if I'm doing it 10 or 15 times individually, it's basically a whole day or 2 days worth of work that I could condense down into maybe an hour or two and get additional benefits. So rethinking how you practice medicine, using education as both diagnostic and therapeutic tool, I think is super important. And that's why, given the opportunity to speak on these things, I'm very grateful, and I really love doing it, because I see it manifesting later on in the follow-up visits. Patients are like, yeah, I feel better. Yeah, the weight's coming off. Oh, and you know what? I went to my primary care, my cardiologist, and they told me I can cut down on my medicines. And so the follow-up visit is not focused so much on, oh my God, what problems are you having? It's celebrating successes. And that's what I really look forward to. It's like, yeah, remember when we first met and things weren't going so well and we had to do this big overhaul of the situation, but now we got the stress component, we have the exercise component, we have the nutrition components, we have the sleep components. You're doing well, feeling better.
Yeah.
And it just becomes it's joyful for the patient, it's enjoyable for me. I'm sure your insurance company loves it because they have less bills to pay. So it's a win-win-win all across the healthcare system. And I think this is where healthcare needs to go, and this is the main mission of the Academy of Integrative Health and Medicine. They're trying to impact even medical education. So here in Hawaii, I'm trying to reconnect with my medical school to help bring these educational opportunities and real life experiences to the medical students, because I had no clue about this until I started going to the Academy of Integrative Health and Medicine. And so I want to encourage the next generation of physicians who are going to be trained in the ill pill, acute care, prescribe medications, order blood tests. Yes, that's still important. But I think what's even more important is understanding people as a whole, helping them, forming relationships, and helping them become their own sensei with their own wellness plan is so vitally important. And that's what's missing in today's healthcare.
It sounds like you're helping patients have a lot of agency over their own health.
Yeah, I want that, because, after I log off from the appointment with them, I'm kind of left there going, I wonder if they're going to pick up their medicine or take their medicine or do the lifestyle interventions. But it's clearly obvious when they come back, if they're doing well, the most gratifying appointments are, you know what, I think I got this. I know I was referred to you a year ago for this positive ANA, but I've lost some weight, I'm sleeping better, my stress is better. Nothing autoimmune has popped up. I know what to do. I know how to reach you if I need to. I'll let you know if there's any problems coming back. And I said, great, wonderful. Not to be rude, but I hope I never see you again, because that means you're
not to need you.
Right, because I think you'll be doing well.
Yeah.
I do end up seeing them in other ways. Some of them reach out, sending thank you messages. A lot of them refer their friends and their family. So a new patient visit, oh, by the way, your patient so-and-so tells you to say hello. I'm like, oh yeah, whatever happened to them? Oh, they're doing well, but I mentioned to them I have similar problems, so they suggested that I see you, and that's the best compliment that anyone can give a provider.
Mhm.
The confidence for referring their friends and family to the provider. But yeah, take a look at those videos, take a look at those resources,
Yeah.
construct your own wellness plan, but also potentially use this as a forum for discussion with your either lupus buddy or your support groups. Because I really, really think that there are a lot of nonprofit organizations, Arthritis Foundation, National Kidney Foundation, which I also volunteer for, Lupus Foundation. They have all these resources, which is great. But what I think needs to happen is that you need somebody to help patients put it all together.
Mhm.
Because I think what happens is people get really focused. Like, I'm going to spend all my time, energy, money on my diet. And then they ignore stress, they ignore exercise, they ignore sleep. And although that's helpful, the diet, if you're ignoring the other pieces, it's not really going to have as beneficial of an effect. And so purposefully, when I created these group visits, when you sign up for it, it's not a la carte. You sign up for all of it, because even if you're doing well, we want to make sure that you're aware of it, you're mindful, and you continue to do well in managing the components which you're doing well in. Because as you add these other components that you're not addressing, you need to not forget about what you're doing well. You need to also do that as well.
Yeah, it's a journey and it's a choice every day to
Correct.
continue on this path of sleeping
Correct.
well and eating well and moving your body.
Correct.
Great.
Correct.
So there's a couple questions that came in through the Q&A. If you don't mind,
Sure.
I'll ask you these, and we have about 10 more minutes before we wrap up. So someone writes in and they say, is the AVISE test worth the money? I have several autoimmune diseases, but not officially diagnosed with some of them.
It really, I have not ordered the AVISE test. I'm aware of it, because like showing that slide where you have the auto antibodies before you actually develop clinical disease, it's kind of, if you're asymptomatic, it's kind of like, not who cares, but is that blood test really going to help you in any way in doing anything? Where did it go? So if you have symptoms that are suggestive of an autoimmune disease, sure. But oftentimes these tests are being ordered, I think, too soon, where the results aren't really going to change what you do. So this again shows not the AVISE test, but a smattering of different autoimmune markers. And time of diagnosis here, these autoantibodies are present, but you can't officially make the diagnosis until you meet certain criteria. So what I generally try to advise my patients and primary cares is focus on how we make the diagnosis with the clinical criteria. Getting all these extensive autoantibody problems, in my opinion, stresses the patients out even more. So again, I see this as a yellow flashing light, like usually it's the positive ANA, and it's an opportunity to work towards wellness. So, if you have an ANA double strand, Smith, myositis, whatever positive, is my intervention or treatment going to change? If you're otherwise asymptomatic and not having any problems, no. I'm still going to suggest to you work on your stress reduction. I'm still going to tell you exercise, nutrition, sleep, all that kind of stuff. So, also too, if you have a copay or a deductible, sometimes these lab tests can be quite expensive. So make sure that if you are going to go and get it, that this is something that's going to be covered. Because again, if you're asymptomatic, the best test to predict for future autoimmune disease is a complete review of systems. So it's a whole bunch of questions that I ask my new patients. Are you having any heart lung, kidney, circulation, symptoms or problems.
Mhm.
And the best rheumatologists are the nosiest ones. So I often keep a list like, who else are you seeing? Why are you seeing them? And patients are like, I say, I'm kind of nosy, and patients are really thankful and appreciative because sometimes a common response is patients are like, well, I didn't know I was supposed to tell you that. And I said, well, that's my job. It's my job to be nosy, to look for the appropriate signs or symptoms that could be related to different connective tissue diseases. It's your job to just tell me and give me the information as best as you can. And so we're a team working towards your diagnosis. And hopefully, best case scenario, we never make a diagnosis. So if you have these autoantibodies, we do know it can happen in 10 to 15% of the normal healthy population that have no diagnosis. And if stress is a contributing factor and you're worried about developing an autoimmune disease because you got all these tests done, maybe that's harmful. That's my take on it.
Great, thank you. And the other question is, this word I can't pronounce, but what can we do to improve dysautonomia symptoms?
Dysautonomia?
Yes.
Yeah. So dysautonomia has several causes. So it really oftentimes depends upon what's causing the dysautonomia, but oftentimes it's associated and or exacerbated with stress. So a lot of the stress reduction interventions can be helpful. But if it's caused by autoimmune attack, also it's treating the autoimmune disease. If it's caused by diabetes, it's getting the diabetes under control. So, stress reduction as what the patient can really focus on, but also to understanding from just a physiologic standpoint what caused the dysautonomia is also important to prevent it from getting worse.
Okay, great. Well, I think that concludes all of our questions. I just want to thank you again so much, Dr. Shibuya. You offered us so many wonderful resources, so much great information to take away. And I just hope that, as you said, people are able to take the insights that they learned today and turn them into action, to really take them into their lives and to see how some of these things that you talked about will work for them and help them. If you want to rewatch the video, so this is for everyone, or if you missed the presentation from earlier, it will be on demand. So you'll get an email with the link. And for additional resources or questions, please visit our website at www.lfnc.org or email us at communications@lfnc.org. I hope you have a good day today and that you will join us for the other lupus health conferences this year. You can watch our social media, our website, or our emails for more information. Thank you again so much, Dr. Shibuya, and thank you everyone for joining.
Bye.
Bye-bye.